Welcome to the Dental Tutors Podcast with your host, Cornay Smith and Adnal Koch.
This is an honest conversation about the questions we all have but might be afraid to ask.
Both on clinical dentistry and topics that go beyond the dental chair.
Join us as we navigate this growing field of dentistry together. Thanks for joining us for part 2 of our conversation with Dr. Jean van Lierop.
What advice would you give the younger dentists that's like kind of right in the start of their careers? How did they find that mountain place, that happy place, and how did they balance that with dentistry?
It's tricky because I've got to. I honestly, you've got to find the one thing that makes you happy that is not at all related to your profession. And I'm not talking about red wine and steaks. Okay, you have to do something that makes you feel better about yourself. Like I've got the mountain. That's why I did 45, for instance. So the idea of 45 was if you can do something for 45 minutes every single day, that makes you better as a person, and you actually build a habit and you become not dependent, but you grow into a healthier lifestyle. So my idea was 45 minutes of exercise, whatever it is, for 45 days, and you build a new habit. And that was anything. You could walk the dog, go walk in the forest, go swim, go cycle, whatever it is. And I just think you need to have that one little thing that is yours, that is only yours. And you have to try and have it 4 or 5 times a week. Yours. Yeah. If you love surfing, go surfing. If you love hiking, go hiking. If you love your animals, then go take your dog, whatever it is, but do something that's you, so you can create the space in your own head and that happy space. And Cornay, like you said, I'm the most grumpiest person in the morning. Absolutely. I'm by far, I know. And I'm without a doubt. Yet if I do something, I'm 10 times better. So I need that. I need that. And I would always encourage I don't care how fit you are, I don't care what, just find something that brings you passion. If it is needlework, then do 45 minutes of just do needlework every day, just to create that space in your head, just to give you that something. So find it and do it. And then I honestly, don't be scared of hard work. Don't be scared of working. More effort. There's a reason a golfer becomes a pro. It's because they practiced. There's a reason why you say that I teach so much, and what I was also 25 years old, not knowing what I'm doing. I was also at that space. I also didn't know how a sectional matrix band works, and I had to learn how to do it. And I practiced and practiced, and I still believe I don't have the best hands in the world. And it's like, without a doubt, there are people out there that have better skill set than I have. But what I've done is I've practiced and practiced and practiced and practiced until I got it right. And when I got it right, I kept on doing it right. And I just grow with that, and you slowly grow. So don't be shy of working hard, because if you work hard, you'll reap the rewards. So put the effort in, but always make sure that you create a space for yourself to reflect on what you've just done. That's for me the balance. Okay, maybe I work too hard often, but I can tell you that when I don't work, I love life. And one special thing for me, and I think that's so important, and I teach that to my kids every day. Like, for instance, you talk about the injection molding course this weekend. I literally put in hours and hours and hours and hours of work into that. It was a passion project for me, and I really worked hard to get it perfect. And then as I was driving at 7:15 in the morning, I was driving to the venue. And as I came past UCT, the sun was rising over the Stellenbosch Mountains. And I looked at it and I thought, how incredibly beautiful is that? How absolutely immaculate is it to look at the sunrise in front of you? And that for me is special. It's that moment where in your craziness and your busyness, you can have that Zen moment almost where you can say, just appreciate how incredible it is around you. How amazing is that? And then take that moment and then feed that through into the rest of the day.
Wow, John, the yes man. Wow. I wanna, yeah, I wanna disagree with you because I've sent you pictures of my preps, and you've said no. What is this? And circled it. So you don't just say yes.
I didn't say I'm not going to criticize. That's why you sent me the picture.
Yeah, then just bringing this back to me sending you guys, both of you, pictures all the time, asking you guys for advice on cases. What has mentorship meant to you, John? Like, who you are mentoring so many younger dentists and so many dentists older than you as well, which is astounding. But what has mentorship meant to you? Not you mentoring, but you being the mentee.
Having a mentor.
Yeah.
Yeah. Mentorship's actually, I'm from the old school. I didn't know what mentorship is. The penny only dropped like maybe a year ago or 2 years ago when Corne started talking about how important Brett's program is because we're mentoring people. I'm like, what is mentorship? What do you mean we're mentoring people? I'm just like, I'm stupid. I'm old. I can't mentor anybody. And then it started me thinking, and I was very fortunate that in my private in my practice, my everything I know today, everything I've learned, my passion, my skill set, everything comes from the 14, 15 years that I spent in Hart Bay at Hart Bay Dental Studio. I was very fortunate to have Andy as an incredible senior partner. And although I was 50% shareholder in the business, I was always the junior. So that's fine. But he was everything for me in that everything I learned from him, not only about how to approach patients, about prep. He was like an insane, he was at the forefront of dentistry at my age. He was like incredible. So I learned a lot from him. I learned from him about business. I learned from him about family, about how do you talk to people, how do you live life, how do you balance life, all these things. And he played a massive role in my life, and I was very, very fortunate to have that. And I keep on telling him that now I can reflect and I can go to him and say, thank you for what you've done for me. He didn't even know it. Half the time he wasn't aware of what was going on. I just had the growth, and I could learn so much behind the scenes, and it was insane. So mentorship for me is an interesting concept. What I see it as is having that person that not necessarily that you aspire to be, because aspiring is kind of, I almost feel like it sometimes can have a negative concept. I don't want to feel like you're the God and I need to just be with you. I don't want to godify you. I want to be able to talk to you. I want to be able to learn from you. I want to be able to ask you a question, and you're going to give me an honest feedback. And it's important to find that person in your life that just does that. That can say, look, what you're doing is cool, but have you ever thought about doing this? Or have you changed that? And pick up the phone and say, dude, what do you think? What would you do? Or just sit quietly in the background and watch them operate and learn from them. But have somebody that you just kind of have a connection with, that you're happy to share with, and they're very happy to share back with you. And that's a special relationship. Um, I love that. I think it's the most important thing that you can do in your career is find that special connection, and it can be more than one person because different spheres, but find that connection.
Okay. Wow. And then
And I
shifting
don't know if
from
I'm a
your,
mentor. I'm not a mentor. Why am I a mentor? I'm just me. I just say,
no, no.
come,
Obviously,
ask me a
shifting
question.
from yeah. Now I was going to ask you that exact question. Now, just mentorship and finding the time for that. We obviously speak about you finding time for your family, finding time for
Yeah.
doing what you love. I'm not saying you don't love mentorship, but it's work, and it takes a lot of effort for you to go through someone's case and give them advice outside of your working hours
Yeah.
as well. How do you balance that with your everyday life?
I will always, if you send me a message and you ask me for an opinion, I will always help you, because that is what I'm supposed to do. That is what makes me happy, and that's where true value lies. Is if I can give you some kind of feedback. It might not be today or tomorrow, but I'll
Yeah,
always give you some kind of feedback. And I think that's important. Balancing it is difficult, but I've never ever said no to anybody to ask me
yeah,
questions, ever. If you want
yeah,
to buy me a bottle of wine and sit me down and let's go have a chat, I will always make time for you. I think that is critical in today's age.
yeah, yeah. And then, what advice would you give to me as a young dentist in finding a proper mentor? Like you mentioned that you had Andy.
Yeah,
Obviously you work with Andy. Me being a young dentist owning my own practice, um,
difficult. Mm.
yeah, finding a mentor
It's
now.
really difficult.
What advice would you have?
Um, I first of all, I think it's very hard to be on your own. It's really exceptionally hard. So my first advice would always be, and I would say that blatantly, that it's better for you to be with people around you than try and be in your own practice, especially in the early days, because you
Yeah,
don't know what you don't know, and you don't know where you're growing, and you don't know, you've got nobody you can bounce ideas with, and there's nobody you can share your stress with. It's an incredibly stressful profession, and if you're sitting alone and you've got no one to talk to, and nobody that can feel the stress that you have of your bad day, then it's really, really hard. So for me, I always, if you had an opportunity to join an existing place or be in an environment where there's more than one, I would take that as a growth opportunity. And it's
yeah,
kind of like, you've got to pay your school fees. You've just got to
yeah,
you've got to learn. So that's my
yeah,
first point. And ideally find a place where at least the principal has invested interest in you. If they have a vested interest in you, then they'll put the effort in to help you. And I think about, I look at the study group in, for instance, I area up in the Wineland Study Club, and I look at those guys, and the amount of senior dentists out there that willingly share information, that willingly will sit with you and just talk, and they will
yeah,
bring youngsters into their practices and share with them. That is for me as a gold mine. And these are just normal people. And I say normal.
yeah,
These are incredible dentists that have worked for many years, and they're willing to sit and invest in you. So find a practice where there's vested interest, where the principal wants to invest. If you're already on your own, join clubs. Go
mm,
to all the study clubs you can find. If there's
yeah,
ITI, and not just because I'm ITI, but if there's ITI, go to ITI. If there's SADA, go to SADA. If there's SAD, go to SAD. If there's study club meeting, go to the meeting. Why? because you connect with every other dentist in your area. And as you connect, you build a network. And then all of a sudden, you start feeling part of something. And then as you feel part, you can easily communicate and chat and get to the bottom of your problems. But be active. Don't sit in your room and think, I'm gonna phone Jean and he's gonna give me all my answers. Life is gonna be brilliant. No, it's not gonna work. You need to go to the meetings, arrive, pitch up, be there. Even if you just sit in the corner for the first year, that's also fine. Just be there. And slowly but surely you'll connect, and slowly but surely you build a relationship. And then it's incredible how doors start opening up for you, and how
That's true.
things change in your life because you've just put yourself in the situation. Just be there. If you're not present, you can't experience it. So be present.
And then
I think
like almost a follow-up question to that, John. And I mean, this is a tricky one. I've been asked this question several times and it's difficult for me to answer it. But if a dentist comes to you and they tell you that they actually want to pursue the educational road, or they want to start lecturing, and they want to know how to actually get into lecturing, what advice would you give that dentist? And this could be a young dentist, this could be an older dentist, anybody.
I would. Where do you start? Well, where did you start, Corne?
You started me. I didn't even start.
You just start. You approach somebody, and you try and get my port of call would be SADA. So I would say try and get yourself into a SADA meeting somewhere, and ideally outside of your province, so somewhere else, because it's a lot more tricky to talk to your colleagues than it is your friends, than it is to a different place. So if you want to get involved in lecturing, my journey was through SADA, or you contact you phone. Like, I mean, I did this with Chris, the injection molding, and Chris has never lectured in his life, but I saw potential. I saw something there, and I think he's an amazing clinician, and he's got a great passion for the profession. And because he's active on all the rounds, I then kind of said, well, why don't we do something together? And then brought him in that way. And he will naturally grow. I know he's going to be incredible dentist, and he'll be an incredible lecturer. I know that. He just needs to grow and experience it. And that's the journey. That's that kind of finding your first steps. It only happens when you make it happen. So if you want to lecture, phone somebody and say, look, I want to try. And then you get a mate and you spend your 40 hours to create your first 40-minute presentation. That's what it is, literally.
Yeah.
It will take you 40 hours to create a 40-minute presentation. So spend your 40 hours, do it, and do it properly. And if you've done it properly, you'll find the next one's easier, and the next one's easier, and the next one's easier. Then it becomes so easy, it becomes difficult, because now it's easy, so you make it difficult. Then you start again.
Oh, wow. So
yes, because it's not a challenge anymore. But then, I mean, I want to highlight a couple of things that you've said, because I think it's extremely important to just to really look at this as almost like as a practical thing to do. So one of the first things you said was that you need to position yourself amongst the community. So you can't just sit in your corner and hide somewhere. You need to be at the meetings. You need to connect. You need to chat to people. You need to start networking. So that's an uncomfortable thing for many of us to do, especially if we're younger, and especially if you might be a bit of an introvert, but you have to put yourself out there at the meetings. So go to all of the meetings. The second thing you said was to connect to mentors. So to connect with people that you actually look up to. And that's a more personal connection. That's not just being at the meeting. That's maybe actually sending a WhatsApp, or like Adnal has done, like actually sending a case. Like, I mean, to be quite honest, I feel pretty cool. I feel awesome when Adnal sends.
I'm very happy. He sends you more cases than me, so it's fine.
So,
Yeah.
no, I have no idea how many cases Admiral sends anyone. The point is, I actually feel valued, and it's nice for me when he values my opinion in something. So I'm going to give him some of my time. And I can honestly say that, I mean, you and I have so many people in Bridge program where they've asked us questions. And I can honestly say that there's not one question that I have not answered, because it's nice to just give that little bit of something. It's just time. And then the third thing that you said, which I think is important to mention, is that you need to be visible. Now, when I say that, I'm talking about social.
Yeah.
I think it does play a role.
Yeah.
You know, if you want to, so I mean, like what we said earlier, Jean, if you want to lecture, it's a little bit of ego, okay?
Just a little bit.
Just a little bit, okay? Now,
it's a big fish.
Very big fish. If you want to stand on a stage and get your point across, you should be able to say something about yourself and the work you do on social media. It's so uncomfortable for me. It's not it's not something that comes naturally to me, but I do it purely because I see it as part of the job. It is literally part of the job for me. So I think
somebody was asking me,
yeah. If you
somebody was asking me, how do you find a job? How am I going to find it? I was literally Bridge program delegate asked me, I'm qualifying. I need to go find a job next year. I'm in ComServe. What do I do? Well, first of all, you go to all your SADA meetings and go to all the meetings you can possibly go to so people know you exist.
Yeah.
Second is you actually speak to people when you're there so they know you exist. And then when they remember you, they need to be able to find you. And if they want to find you, they've got to see on your social media that you do dentistry. You don't just hang out with your boyfriend or take the dogs for a walk or run up the mountain. You actually do dentistry. Whether it's a case, it doesn't have to be a case. It could be you at a course. It could be you doing something cool in your practice. But you have to build that kind of aspect into it. Otherwise, I mean, if I'm going to employ you, why would I employ you? You haven't done anything to tell me that you love what you do. So do that. That's critical.
Yeah.
And that's
how I met.
The same with we talk about mentoring and for instance, like I'm privileged enough to be with ITI. We talk about ITI meetings and stuff like that. And I was 2007, 2008, ITI was founded in Southern Africa. And I had Blackie Swart and Wolfie and Paul van Sal and those guys who are like the gods of dentistry in the country. They were part of the organization. And I was able to, I literally sat around a table with Blackie and Wolfie and Paul van Sal in their practice discussing cases. And it was mind-blowing to see. And I was young. I was like 30 odd years old. And I'm like a lighty. And these guys were just chatting. And they were just bottle of wine, having a chat, talking about things, learning, sharing, planning. And they listened to what you're saying. They were like, okay, that's cool. So what if we do this with that? Okay. And that connection happened. So, but I had to get there. I had to get myself in a car to drive there, to be at the meeting, to sit there with them and experience it. Otherwise, it would not have happened.
Yeah.
So it's position.
Yeah, it's quite. Yeah, I was. So I obviously met both of you guys at one of your lectures, and that just going to these lectures and going to these congresses has just completely changed the way that I look at dentistry. The main thing that I learned from, I would say, there's a very small group of people who have completely changed my mind about dentistry, and you two are obviously two of them. Obviously saw you guys lecturing, and the main thing that stood out to me was I realized how little I love dentistry. I thought I loved dentistry a lot up until I heard you guys speak about dentistry. And I was like, damn. Like,
I was crying on the stage saying, I'm so passionate. I've cried in front of delegates. I literally have done that, by the way. But
damn.
Okay.
When you see that emergence profile, you're like, oh, that's so beautiful.
Sexy.
Yeah, so actually one of my first ITI congresses, the only ITI congress I've ever been to, I met Blackie there. And he literally I was having a beer, he came over and spoke to me, and I was so nervous because I've obviously only heard of him, I've never actually met him. And he invited me to his practice. I went the very next day. I think I was like 23 years old, 23, 24. He invited me to his practice. I went the very next day, and I thought he was just going to put me in a corner and let me sit there and he would speak. He would speak to the patient and then consult and whatever. And he just started asking opinion after opinion. And what do I think of this? What do I think of this case?
Wow.
And that just completely blew my mind. And had I not gone to that ITI Congress, where I didn't understand a single word that was being said there, like I didn't understand those lectures. That was just, that went over my head. But that's where I met him. Those lectures of you guys, that's why I met you guys. And it's very, very important for people to attend lectures. And then back to ITI, there's obviously the new educational program that's starting.
Yeah.
And you're obviously involved with that, John, and that's very exciting. You want to tell us a little bit more about that?
So ITI, I think the biggest thing with ITI is just like you were talking about, having met Blackie and you're sitting in his surgery and he asking you questions, he's connecting, that's Blackie. With ITI, the incredible thing about ITI is that it's a global. I mean, this is absolutely global. So like you would have experienced Blackie. In the same organization, there's a guy sitting in Italy or in America or in Canada or in Australia that's experiencing the same thing. They're also getting that. They're also getting that connection. They're also getting that mentorship, and and that's what makes it so insane. Just to be part of the 23,000 members that are the ITI. So that's the first thing. And then what I've learned is how much information is actually available, and how over the 20 odd years that they've been around, they've gathered all this knowledge base. And we needed to figure out a way how we can get all this knowledge to people in South Africa, because nobody was using it. Nobody was accessing any of the information. So we had to figure out how can we get all this knowledge and bring all this incredible vast information to the general dentist. And so the idea of the ITI curriculum was born in South Africa. The ITI curriculum itself, foundation level, for instance, is the first step of a 3-step process. And that's a global structure. In other words, ITI Global, they created the foundation level, they've created the intermediate level, and they've created the diploma as a structured course. So what we did is went, okay, this course exists. How can we implement that in South Africa? And we like I said, you get an idea and you go with it. You just run with it. So we basically started the concept of, let's take the foundation level, let's unpack that, and let's do this on a completely hybrid model. In other words, we want to give you the mentorship, we want to give you the information, and we want to give you the actual clinical guidance. So throughout the 12-week process, we'll be talking to you once a week, where you can ask any questions, absolutely anything. And for an hour and a half, you'll have 3, 4, 5 dentists who are the leaders in their field that you can ask any question about. And then through that, you then work your way through all the different modules that's in the ITI. So obviously everything implant-based, from planning to radiographs to implant restoration, through implant maintenance and complication behavior and all of those things. And we do that on a modular basis. And then hand in hand with that, you have the facial connection. So you come in, We sit down with everybody, and everybody gets an opportunity to play with instruments, to work on the models, to really reiterate what they've learned online. But then all the online content is obviously curated through the interrelational curriculum. And then what we do is we'll repackage it slightly with a South African flavor, and we'll give you our cases. So we'll say, this is the case I did using this concept, using this process that you just learned through all the 10 videos that you just watched over the past 2 weeks. That's the idea. So we just reiterate and build. So I'm really, really excited. It's massive. It's massive. I'm super proud of what the team's been able to put together, and now we just need people to share in the excitement.
So, Jean, is this very much geared towards the younger dentist, or is it something that I could still do?
You can definitely do it, and
so
I mean that with love and care. It's for everyone.
I mean it with love
completely.
and care as well.
Wait, did you just exclude yourself from young, eh?
I've just excluded myself from the young dentist.
Everything, it's for everyone, and I tell you why, because I've been doing implant dentistry 20 years, restoring implants. I've never ever placed an implant in my entire life, nor will I ever place an implant, but I've restored implants. I had to go through the curriculum to see everything that's out there, and I was dumbfounded by how little I knew.
Okay.
So I'm studying so that I can share more knowledge. Not that I haven't got the experience, but I don't always have the scientific background or the thought process or the reasoning behind it. So I think it's incredible what's there. So it's definitely for everybody. It is a restorative driven program, because I believe all implant dentistry is driven by the restorative dentist. So our aim is to empower the dentist who needs to restore and refer implant dentistry, so that you can have a communication with your surgeon, that you can tell the surgeon that they made a mistake with confidence, or you can pat your surgeon on the back and say, awesome, that was incredible, and then work your way through that. It empowers you to be able to be confident in implants, whether you've done it for 2 years or for 20 years. You are definitely going to learn something.
Okay, that's pretty cool, because I think that, it's like, I was like, oh, this looks cool. Oh, but I think I'm too old. Oh, but it's so cool. Oh, but you know what I mean? Like, it's
completely.
Nice. I understand that your focus would probably be the younger crowd, but I think there's not.
But young. What is young? Young. It's young in implant dentistry.
Fair enough.
There's a difference.
But also, if you think about it, so I mean, just take myself as an example. So I've been restoring implants since 2008. So it's been a while. However, I've never done any formal education. Yes, I've done a couple of courses. And yes, I've done like weekend course here, weekend course here. I think it would be really nice for me to do something formal in implant dentistry as a restorative dentist. Yeah. So that was really my thinking behind like even looking at this. And I think that's why this is so powerful, because we have incredible implant education in South Africa. Like I think literally world class.
Insane.
But there's never been anything formally structured. And I think this is great.
Yeah. Excited. Nervous, but excited.
Well done, man. In closing,
tell my family that.
You need to go. We need to let you go. I would like to, from the bottom of my heart, say thank you to you. You know how much I love you and how much I respect you. As a friend, as a colleague, as my business partner, I would not have been where I am in dentistry or in life was it not for you. And I've said this in front of people and just to you. And I will say this over and over again. I am eternally grateful to have you in my life. Before I get too
You
emotional,
make me cry now.
over
Damn.
to Admiral to just end off the podcast and to bid us all farewell.
Yeah, Jean,
Thank
thank you so much for tonight. This was absolutely amazing. And we can't wait for this to air. Awesome. Thank you so much.
It's an absolute
Cool.
pleasure. Thank you, guys. You are amazing. You are the future of dentistry. Eh? Remember that.
Thank
Keep
you.
on doing the good work.
Yeah, thank you.
Thank you so much for joining us today on the Dental Tutors podcast.
Please visit, like, comment, and subscribe on our platforms below.
Or if you have any questions, please send us an email.
Until next time, have a great day further.